This program was produced by and first broadcast on Radio Kidnappers, a community access media station. Thanks to New Zealand On Air for making this type of programming possible.
Good morning, this is Heiko from the Acupuncture and Air Show. Every Tuesday at 11 o'clock, which is right now, we're going to be talking to different members, Acupuncture New Zealand members around the country. And today we're going to be talking with Kane Monrad. Now, he's an ACC accredited acupuncturist from Hamilton. How are you doing, Kane?
Good, thanks, guys. How are you going over there? And thanks for having me on the show.
Yep. Now, look, today we're going to be talking about something probably that, I guess 90% of people on the planet have had at some stage is knee pain. And, of course, there's a lot of different types of knee pain. So, why don't you just tell us first some of the types of knee pain that acupuncture can help with?
Yeah, in the clinic we can have anything from dislocation, meniscal tears, Baker's cyst, arthritis, tendinitis, simple wear and tear. It's just, one thing that amazes me about the knee is that if an average of 70 kg body weight, going downhill is equivalent to 210 kgs on the knee. So right. That's a whole lot of pressure on the knee, especially if you're doing stair work quite a lot.
Right, okay. Well, I think I weigh more than 70 kgs.
So you're in trouble then.
Now, I know a lot of these injuries are covered by ACC. Is it all injuries, or can you just elaborate on that?
Yeah, so the injuries that we treat here, the main injuries I treat, especially if we're looking at knee pain, would probably be like the cruciate ligaments. That's the ligaments that make the X under the knee.
Yeah.
That gives us the stability there, and also the meniscal tears. So they're the mainly common sports, and it's mainly with sports I see because I do a lot of the gym goers and things like that. Is there
any specific sports that are sort of prone to getting those type of, like, I don't know, skiing or something?
A lot of the sports that are jumping or switching to movements very quickly, where they overextend the knee or move in a way that it shouldn't move naturally. And because these ligaments are there to keep the knee in place, sudden jerky movements can tear these ligaments.
Okay. Now, I know in some instances, surgery may be required, but what about treatment for, as you mentioned, a meniscus tear? What would you do? Do you just stick them in like locally, or do you have special points or areas that you work with?
Okay, so for me, I do points around the knee, or I do points distally as well, which means that we can.
Are they just random spots, or are they specific acupuncture points?
No, there's specific points that have an effect on the local, on the distal area.
Okay.
So it could be the mirror image to that point. So,
right.
So yeah, I do. There's different types of acupuncture, and one of my styles is Dong's acupuncture.
Right. Okay. Now, why don't you just tell us a little about this Tung method? Where did you study it, and how do you apply it? How is it maybe a little bit different to other acupuncture?
Okay, so Master Dong's acupuncture is a Taiwanese-style acupuncture. Master Dong himself was referred to as one of the greatest acupuncture masters who ever lived. Master Dong's points were treasured as a family secret and then handed down and refined over the generations and explained really... basically, it's simple, easy, and effective, but there's sort of go-to points for certain areas, and there's reasons behind that, obviously. I look at it as the nuts and bolts are the same as an 8-principle acupuncture, but the understanding is slightly different how they would use and do the points. So for me, I trained in Australia a lot, and I trained under some good doctors, Dr. Wei Chi Young, Susan Johnston, Dr. Pan, Dr. Robert Chu, Henry McLean, and Dr. Peldon Carson, who are all Dr. Tung's acupuncture.
Fantastic. Now, we know that in our last show, we're talking about moxibustion, and you actually sell quite a few moxibustion products to practitioners. But tell us, for example, the use of moxibustion in, say, for example, a meniscus tear or a cruciate ligament injury, and can the patient do anything at home, to help in between the treatments?
Sure. So the purpose of Moxa, so even if we're doing distal points, we can do Moxa in the area. And the purpose of Moxa, as if you're not aware of, if you haven't listened to some of the talks before, is the treatment to help stimulate circulation through the points to encourage better flow. So if we can encourage better flow through the channel pathways, through the meridians, through the muscles, then it helps pull dampness or cold out of the area. And it's you would have heard some people say, I know when the cold season's coming because my knee gets sore or their joints get sore. So
yeah, I can see Ken now. He's rubbing his elbows and his knees. It's an old bloke. Go on, Ken.
Yeah. So the good thing is that Moxa is very, very beneficial for pulling cold out of that area and using them at home, which we have Moxa sticks that we can use at home that I give my clients, and they can just do that to continue the treatment, and it just has a long-lasting, longer effect on that area.
Great. Now, I know that, I try to get patients to do self-help at home with Moxa. You give them the stick, you show them how to light it, and then how to do it and everything like that. But then I just find even when people are in pain, they just get too busy even to help themselves. But and that's why I love those Moxa patches that you have. It's sort of like the 21st century TCM style, and so you can put them on before you go to bed, and then you can sort of heal yourself while you're sleeping. And I've got one question about knees and injuries generally. What about exercises? I mean, do you yourself advocate very many exercises to accelerate the recovery? And I've sort of found myself that with many patients, having gone through some kind of exercise regime, maybe with a physio, it's sort of one or the other. It either sort of it can help, but often it actually then re-aggravates the injury. So I'm tend to, for my personal self, is rest is best. But what about you? What's your sort of take on that matter?
Yeah. I mean, like you, Heiko, I find it extremely hard to get people to do anything outside the clinic. A lot of people say they have no time. A lot of people will do it once and then, I missed it, and a couple of days goes by and they sort of forget all about it. But in saying that, I do like that rest approach to help the body rebuild, repair. It just helps everything to rest, rejuvenate, and then the body can start to heal. I mean, people with tennis elbow all the time, they keep working it, and what happens is they get ill. But when they rest it, it starts to come right a whole lot more, and I find they need the same thing.
Just on that subject, because we've just gone out of lockdown, and I've just basically not been quite back for a week yet, and then some of these patients who then have had no treatment for 6 weeks, but also not worked for 6 weeks, and surprisingly, so many of them are so much better. And so as soon as I went back to work, it's all come back again.
Yeah, yeah, exactly.
Now, we still got a little bit of time left. Ken's sort of waving over there, keeping an eye on the time. Arthritis of the knee. I mean, of course, it's common, and we have,
Sure.
Osteoarthritis, rheumatoid arthritis. How would you approach this using the Master Tung style? And does Master Tung use the Moxa as well? Okay, so in Tung's method, we have some amazing points, right? We call them the go-to points. So if you have neck pain that radiates down the back of the neck and into the rhomboid mid-back, we would use specific points like the upright tendons. Doesn't matter what the cause is, right? Right. And then we can mix that with other things. So for knee pain, and especially if it's bone on bone, we would use the upright tendon. We would use the 4 flower bone points on the leg, and that has a reaction area to bone or any bone injuries in the body. So slip disc, folding disc, arthritis, osteoarthritis,
knee pain. You know, so
Well, geez, I better do a trip to Hamilton and you better teach me these, mate. It sounds good.
And then for the knee, we would use other points depending on where it is. We would check the location of the pain, and then we would go from there as well. But also point on the small finger, around the end of the tip of the small finger, around SI1 if you're an acupuncturist.
Yep.
We know the area. Very, very good for arthritis of the knee. And then local treatment, we can do moxa on the knee eyes or around the medial meniscus, things like that, or wherever the pain is. But in Dung's method, he only moxed one point to tonify the whole body or build up the whole body, and that was a large intestine 10. So that was the only point he ever moxed, just to build up the body, help the white blood cell count, and very, very good for anemia. But I mix it up. I don't mind to put distal points in and then do local points and then do local moxers around the area as well.
Okay. All right, well, we're getting just about towards the end of our show, and just very quickly, have you got any secret tongue points, to help with push-ups? Because I know that you and I are on a roll to get to being able to do 100 push-ups. I suppose you're cheating, are you? And you got some secret points to boost your strength?
Well, if you buy enough moxa off me, I'll tell you.
Yeah.
What I think you guys should actually do is, push-ups are okay, but I think you should be doing chin-ups. 100 chin-ups, go on.
Yeah. And they're different too, because
that's where you light the fire under the feet.
That's right. That's the moxa that you need.
Yeah.
All right, well, listen, thanks again, Kane, for coming in. That's much appreciated. And I will get up to Hamilton and do a day's work with you at some stage and learn some of these tongue techniques. And to finish off, we've got this is probably Kane, one of your favourites, and Ken, favourite, a song by Peter Tosh called Step and Razor. I'm sure you're both really familiar with it.
One of my favourites of all time.
Yeah.
Thanks for having me, guys.
Okay, catch you soon.
This program was produced by and first broadcast on Radio Kidnappers, a community access media station. Thanks to New Zealand On Air for making this type of programming possible.